And that has drastically changed my life. I mean, not to have to take insulin shots. I feel significantly better.
Lynn Yanel was taking 4 insulin shots a day. It was the only way she could control her diabetes.
I feel better emotionally, physically, and I'm very, very pleased.
Now Lynn is much lighter and off most of her medications, including those 4 insulin shots.
As of today, I've lost 80 pounds in 6 months, and I'm very excited about that. I would maybe like to lose another 10, but everyone tells me that I should leave it be.
Lynn chose the bariatric program at the University of Chicago Medicine, one of the leading programs in the country. She had the gastric bypass procedure and is very happy with the results.
The reason that I chose University of Chicago Medicine is because they had a program, Dr. Hussein had a program to go along with the bypass. You had to go to classes, you had to follow up. I mean, there was a whole plan.
What differentiates us from everybody else is, I think, our experience, our judgment, and our comprehensive evaluation of patients.
UChicago Medicine offers many options for weight loss. Some of those options include surgery, their sleeve gastrectomy, gastric bypass, and a procedure for extremely heavy patients that is only done at about 1% of the centers in the country that's called the duodenal switch.
As an institution, we are providing a wide array of options for patients who are trying to lose weight, whether it's that 10 pounds you need to lose after Christmas, or it's that 200 pounds that you've accumulated over years.
Each of these procedures requires a team approach. The patient will work with several caregivers to assess their challenges and provide solutions. There is also follow-up after the procedure to make sure the patient has the right support to keep the weight off.
So at a single hospital visit, they will see the surgical team, they will see our bariatric dietitians, as well as our psychologists. And so it's a one-stop shop, if you will.
Weight loss isn't easy, and the patients who participate in the surgical program have struggled with their situations for years prior. But the positive news is there is hope, and it can be a lasting change.
Despite all of our biases, we don't know why people are overweight. It's easy to say they eat more food than they actually burn off. And while that may be true, we don't understand why some patients are more efficient at burning off food than others.
Obesity is a complex issue. It has to do with your genes, what you're eating, what your habits are, what your social behavior is, what your psychological situation is. So it's a complex issue, so it doesn't have just one solution. Surgery happens to be the most effective way to help people lose weight, but we realize it doesn't function in a vacuum.
Lynn's family is happy with her outcome as well. It has changed her life and helped her to a healthier existence.
Since I did the surgery, I feel much better about myself. I am much more confident. I do a lot more things. I do double takes in the mirror every time I walk by a window. Every time. I absolutely do not believe that I look like this, and I feel very, very good about it.